This next video vignette is on frequently asked questions. Probably the most common question that I get is, how long does it take to recover from a joint replacement? Well, in general, it takes about 3 months to recover from a hip joint replacement or a knee joint replacement. Typically, it's about 6 months before you're totally pain-free. And then the next thing that people want to know is, how soon can they drive? Well, the answer is typically about a month after a joint is replaced, you can drive. When do my staples come out? Most of the time, we do not use staples. We actually use something called Dermabond, which is basically a fancy term for superglue to close the skin. Typically, you have sutures underneath that dissolve, and so you don't have to have any staples removed. Sometimes we do use staples under certain conditions, and if you do have staples, those should be removed at 2 weeks after the surgery. When can I return to work? Typically, you can return to work after a joint replacement if you are doing a non-manual labor job at about 6 weeks after the surgery, and if you're involved in manual labor, typically about 3 months before you really feel like getting back to work. What is a revision joint replacement? A revision joint replacement is where we take out a prosthesis that's worn out and replace it. Typically, after about 10 or 20 years, a prosthesis will wear out, or it will come loose, or perhaps develop an infection, or the ligaments will become stretched out. And so we have to take out the old prosthesis and put in a different kind of prosthesis or a new prosthesis. And so revision is a little more complicated than a prosthesis that we put in for the first time, because you're having to take the old prosthesis out and put in a new prosthesis. How long do I use a walker after a joint replacement? A walker is typically used after a joint replacement for about a month after a total knee replacement, or after a replacement of the hip done through the lateral approach, that is, through the side. With partial knee replacements and with the anterior approach to the hip, typically you only use a walker for about a week. So to summarize, you use a walker for a month after a total knee or a lateral approach total hip or posterior approach total hip. You use it only for a week, usually with a partial knee replacement and an anterior approach total hip. How do I get a hold of Dr. Doss in case of emergency after surgery or a similar such problem? If you have an emergency, you can call the Pardee Hospital operator at 828-696-1000 and ask to speak to the doctor on call for Dr. Doss, myself. If you've never seen me before and you need a joint replacement urgently, how can you get in sooner than a routinely scheduled appointment? Well, you simply send your x-rays to Dr. Doss's office, my office, at 2315 Asheville Highway, Suite 20, Hendersonville, North Carolina, 28739, or call my office at 828-692-4356 and ask to be scheduled to come in for a screening x-ray. If, after looking at that x-ray, it's apparent that you need a joint replacement, we will expedite your visit to the office, and also, whether or not you do, I'll give you a call and let you know what the x-ray showed. What is the difference between a total knee replacement and a partial knee replacement? There is a difference between a total knee replacement and a partial knee replacement. You know what a total knee replacement is if you've seen my video on what is a joint replacement, but a total knee replacement is where we remove about a ½ an inch of the end of both bones. And we put a metal cap over the end of the bone here. With a plastic bearing here. It's a very special plastic called highly cross-linked ultra-high molecular weight polyethylene. And then a metal plate here. With a stem that goes down inside of the bone. And that is a total knee replacement. Now there's such a thing as a partial knee replacement. A partial knee replacement. Partial knee replacement is exactly what you think it would be. It's where, instead of replacing the whole knee, we replace only part of the knee. Only certain people can have a partial knee replacement, but if your arthritis is limited to one side of your knee, not the other side, and you've got good cartilage on the other side of the knee, this represents good cartilage, nothing need be done to this side of the knee, then only this side of the knee is replaced with a metal cap only on one side of the knee as opposed to both sides of the knee, the plastic bearing only on one side of the knee as opposed to both sides of the knee, and the metal plate once again only on one side of the knee and not the whole knee. And that's the difference between a partial knee replacement and a total knee replacement. What are the three different surgical approaches to the hip, and what's the difference between them? Well, there are three different ways to get into a hip, that is, three different surgical approaches to the hip. Surgical approaches. There's one is the posterior approach. Two, the lateral approach. And three is the anterior approach, something new. You've probably heard about that and you're probably a little curious about it. So let's talk a little bit about each one of these. The posterior approach is where you go through the back of the hip here. The lateral approach is where you go through the side of the hip here. The anterior approach is where you go through the front of the hip here. So once again, the posterior approach is the back of the hip, the lateral approach is the side of the hip, and the anterior approach is where you go through the front of the hip. The first approach that was developed was the posterior approach. The nice thing about the posterior approach is it's very safe. The surgeon can see everything he needs to see. The disadvantage of the posterior approach is you have to cut through the short external rotator muscles, which are the muscles that hold the hip inside the socket, so there's a higher rate of dislocation. The lateral approach is where you go through the side of the hip. That was the next one that was discovered, and the nice thing about that is, once again, the surgeon can see the hip very nicely, has a good wide view, and you don't have to cut the short external rotator muscle, so it has a very low dislocation rate. The disadvantage is that you do cut through the major hip muscles, so you're more likely to have a limp after the surgery. The anterior approach is the latest thing. It's something new. Only about 18% of hip replacements are done through the anterior approach now, but more and more are being done. People like those because it's a quicker recovery, because you don't have to cut any muscles or tendons. You just separate the muscles, and the recovery is a little quicker, so you only use a walker for about a week with the anterior approach, and then a cane for a couple of months. So the recovery is just a little bit easier, a little quicker with the anterior approach. The disadvantage of the anterior approach is you're right next to the major nerve and artery, so there's a very high incidence of numbness of the hip due to some nerve damage. Which one of these is the best? Darn, I don't hear anything. I was hoping you'd tell me, because we don't know either. Actually, they're all basically equivalent. They each have their advantages and disadvantages.